Arches of foot. In this video, we will learn about the types of arches of the foot, their structure and supporting factors, their main functions, and important clinical conditions like flat foot, pes cavus, and clubfoot. Let's begin. Arches of the foot help in fast walking, running, and jumping. Arches are supported by intrinsic and extrinsic muscles of the sole and ligaments, aponeurosis, and shape of the bones. Footprints are not complete due to the arches. As a pliable platform to support the body weight in the upright posture, the human foot is designed in the form of elastic arches or springs. The presence of the arches makes the sole concave. Classification of arches: longitudinal arches, medial longitudinal arches, lateral longitudinal arches, transverse arches, anterior transverse arches, posterior transverse arches. Formation or structure of arches: medial longitudinal arch. This arch is considerably higher, more mobile and resilient than the lateral. Ans. The anterior end is formed by the heads of the first, second, and third metatarsals. The phalanges do not take part in forming the arches. The posterior end of this arch is formed by the medial tubercle of the calcaneum. Summit. The summit of the arch is formed by the superior articular surface of the body of the talus. Pillars. The anterior pillar is long and weak. It is formed by the talus, the navicular, the three cuneiform bones, and the first three metatarsal bones. The posterior pillars are short and strong. It is formed by the medial part of the calcaneum. Main joint of the arch is the calcaneo-navicular joint. Lateral longitudinal arch. This arch is characteristically low, has limited mobility, and is built to transmit weight and thrust to the ground. Ends. The anterior ends of the arch is formed by the heads of the fourth and fifth metatarsal bones. The posterior ends is formed by the lateral tubercle of the calcaneum summit. The summit lies at the level of the articular facets on the superior surface of the calcaneum at the level of the subtalar joint pillars. The anterior pillar is long and weak. It is formed by the cuboid bone and by the fourth and fifth metatarsals. The posterior pillar is short and strong. It is formed by the lateral half of the calcaneum. Main joint. The main joint of the arch is the calcaneo-cuboid joint. Factors maintaining the medial longitudinal arch. Bones. The sustentaculum tali partly support the head of talus. Ligaments. The important ligaments which help to maintain the medial longitudinal arch are plantar calcaneo-navicular ligament, also known as spring ligament, which provides dynamic support to the head of talus. Interosseous ligaments connecting the adjacent bones, and interosseous talocalcanean ligament connecting these bones. These ligaments act as intersegmental ties. muscles, tendons, and aponeurosis, acting as slings, that is, suspending arch from above. The tendon of tibialis posterior, lying underneath the spring ligament, provides dynamic supports to the head of talus and suspends the arch from above. In this endeavor, it is aptly supported by the tendons of flexor hallucis longus. The flexor hallucis longus is the bulkiest and strongest muscle to support the medial longitudinal arch. This muscle has three functions with respect to the medial longitudinal arch. It stretches the arch like the string of a bow. It supports the calcaneus by passing along its posterior groove. The tendon of tibialis anterior also exerts a sling action. Acting as slings, the tendons of peroneus brevis and peroneus tertius, which are inserted on the base of the fifth metatarsal, act as weak slings from above. The tendon of peroneus longus, which grooves the plantar aspect of cuboid and courses transversely across the sole, to be inserted on the base of first metatarsal. An adjoining part of medial cuneiform supports the cuboid bone from above through its pulley-like action. Transverse arches. Anterior transverse arch. The heads of the metatarsals form the anterior transverse arch. It is a complete arch because during standing position, the heads of first and fifth metatarsals come into contact to the ground and form the two ends of the arch. Posterior transverse arch. The posterior transverse arch is formed by greater parts of the tarsus and metatarsus. It is an incomplete arch because only its lateral end comes into contact with the ground during standing position. It forms only half of the dome in one foot. The complete dome is formed when the 2 feet are brought together. Factors maintaining the transverse arches. Bones. Most of the tarsal and metatarsal bones have larger dorsal and smaller plantar surfaces, that is, wedge-shaped, which help to form and maintain the concavity on the plantar aspect of the foot skeleton. Ligaments. These are small ligaments which bind together the cuneiform bones. And metatarsals. Superficial and deep transverse metatarsal ligaments at the heads of metatarsals function as intersegmental ties to maintain the shallow arch at the heads of metatarsals. Muscles and tendons acting as tie beams. The tendons of peroneus longus and tibialis posterior support the transverse arch as tie beam, acting as slings. The peroneus tertius and peroneus brevis on the lateral side, and tibialis anterior on the medial side, support the transverse arch as slings, acting as intersegmental ties. The dorsal interossae act as intersegmental ties. Functions of the arches. The functions of the arches of the foot are as follows. Distribute the body weight to the weight-bearing points of the sole, such as heel, balls of the toes, mainly those of first and fifth toes, and lateral border of the sole. Act as shock absorber during jumping by their spring-like action. The medial longitudinal arch provides a propulsive force during locomotion. The lateral longitudinal arch functions as a static organ of support and weight transmission. The concavity of the arches protects the nerves and vessels of the sole. Clinical anatomy. Flat foot or pes planus. The flat foot is the commonest of all foot problems. It occurs due to the collapse of medial longitudinal arch. During long periods of standing, the plantar aponeurosis and spring ligament are overstretched. As a result, the support of the head of talus is lost and is pushed downward between the calcaneus and the navicular bones. This leads to flattening of the medial longitudinal arch with lateral deviation of the foot. The effects of the flat foot are: the person usually has clumsy, shuffling gait due to the loss of spring in the foot. Makes the foot more liable to trauma due to loss of the shock absorbing function. The compression of the nerves and vessels of the sole is due to the loss of concavity of the sole. High-arched foot, pes cavus. The exaggeration of the longitudinal arch of the foot causes pes cavus. This usually occurs because of a contracture, plantar flexion, at the transverse tarsal joint. When the patient walks with a high-arched foot, there is dorsiflexion of the metatarsophalangeal joints and the plantar flexion of the inner phalangeal joints of the toes. Clubfoot or talipes. The clubfoot may be congenital or acquired. There are 5 types of clubfoot as under. Talipes equinus, horse-like. In this condition, the foot is plantar flexed and person walks on the toes with heel raised. Talipes calcaneus. In this condition, the person walks on the heel with forefoot raised. Talipes varus. In this condition, the foot is inverted and adducted. The person walks on the outer border of the foot. Talipes valgus. In this condition, the foot is everted and abducted. The person walks on the inner border of his foot. That's a quick overview of the arches of the foot and their clinical importance. Thanks for watching.